I met Lt Col Fang, Ray to me, when I was in Landstuhl. I was the senior visiting surgeon for the American Association for the Surgery of Trauma, and Ray was the chief of trauma at the Landstuhl Regional Medical Center. So we spent several weeks together, conferring, working, having dinner, getting to know one another, and I was just so impressed with his intellect and his thought processes and his absolute commitment to taking care of injured soldiers.
He's not your typical trauma surgeon. Most surgeons are very aggressive sometimes. They're very stern. Dr. Fang is more laid back. It can be hitting the fan and he's calm. He doesn't yell. He has an insight to what's going on. He can calm a room just by his presence, the way he speaks, and you just feel safe with him around.
One of the things that's really unique about Ray is his ability to work with just about anybody, and regardless of what their demeanor is. Ray is relatively quiet, easygoing, but he has the capability of pulling a team together around him, whether maybe you started off thinking that you wanted to do this or not. Ray will find sort of the best way to utilize your skills and your talents to optimize casualty care.
Ray has been influential on a number of levels in terms of improving medical care. The first is he's a great doctor. He's a tremendously competent technical surgeon. He's a caring guy. He spends hours with the families. He spends hours teaching the residents, and he's wonderful in the intensive care unit, in the resuscitation unit, in the operating room. And there's no better way to teach than being really good.
He communicates very well. He's very politically savvy. I have seen him engaged with physicians, nurses, respiratory therapists, techs, the ward clerk. He treats everyone the same. It's not about him, it's not about his notoriety, it's about how can I improve this patient's care, their outcomes, and that's how he looks at everything.
And I've known Ray since he was in his 4th year of medical school, and really ever since that time, Ray has been a devout teacher for those that were really following behind him.
Well, when you meet Ray, you know he gets it. He's composed, he's not flashy, he always gets the job done. He's understated, he doesn't need to call attention to himself. He's about the process, he's not about Ray. And I think that's key if you really want to be excellent. If you worry about drawing attention to yourself, you're never really very good. You might be famous, but you're really not very good. And that's the antithesis of Ray.
He cares on a level that is truly shocking to see. I don't know if it's because of all the time he spent at Landstuhl. I think it's just Ray. That's what he does.
One of the things that Ray always says is best medicine today, but better tomorrow. And Ray never accepts the status quo, and he always thinks that we can do better.
He's immensely compassionate. He really cares about the patients, he cares about his people, he cares about the Air Force, he cares about his family, cares about his colleagues. He's just wonderful.
I think Dr. Ray Fang was selected for this prestigious award, the Air Force Hero of Military Medicine. Just in the title alone, hero. You know, what is a hero? It's someone that is recognized for their accomplishment and their noble qualities. He has done so much for the system of care. He has taken us to levels beyond what we ever thought possible.
Ray, I'd like to congratulate you on an honor, well-deserved, and I think that your opportunities that you have passed on to so many casualties is what you will be remembered by.
Ray, we're all so pleased that you're getting this honor. Having you be part of the shock trauma family has been an institutional pleasure. It's been a personal pleasure. As far as I'm concerned, the best is still yet to come. Congratulations.